Hi guys, it's Tony the vet, and today I want to talk to you about cystitis in cats. Now, in practice, this is something that we see fairly regularly because a lot of people that have cats will often be able to monitor them going to the litter tray, and they'll be able to pick up on when things become abnormal. So cystitis is something that we see a lot of, and it's something that is fairly regularly treated in practice. Now, there's multiple factors affecting cystitis. And even the word cystitis, it just means inflammation of the bladder. So oftentimes you'll be dealing with infection and sometimes even a little bit of blood. So the primary causes are many, but one of the things that we sometimes see is pets that are very stressed tend to get recurrent cystitis. So if they're in multi-cat households, or there's furniture being moved around, or there's some stressor in the environment, it can sometimes elicit the symptoms of cystitis. And then what can happen is an opportunistic pathogen will track up into the bladder, and they'll get a cystitis that can lead to them going to the tray and weeing more. So with some of these cats, they will need antibiotics and anti-inflammatory painkillers to help them along, just so they don't end up in a lot of pain and distress. A lot of the time the cystitis is treated symptomatically, so you assume there's a bacterial agent and an antibiotic is used. The course and duration of the course of treatment is dependent on what the vet finds when they're doing the clinical exam and taking the history, but a lot of the broad spectrum antibiotics will cover most of the agents that can cause cystitis. Cats, being carnivores, will have a lot of nitrogen that they need to break down in their bodies, so a lot of the factors that go hand in hand with breaking down all that meat and the various things in their diet can sometimes make them more susceptible to cystitis. So one of the things that we see sometimes when we send urine for analysis and sampling is that they'll have crystals in the urine. Some of these crystals would include struvites. They're the most common one that we see. So if you see these crystals, it's effectively like having a little bit of sand in their bladder, which causes irritation to the bladder wall. And again, signs of cystitis, like going to the litter tray more often, maybe some blood in the urine, or else a little red tint to the urine. So it'll come out looking a little bit like rosé wine or something similar. If you do see that, there's a good chance your cat has cystitis. In a female cat, these crystals will often just be passed out in the urine, but will lead to recurrent bouts of cystitis. So again, trying to get a diagnosis is the best way to go about that, because if you do have a need to change the diet and you need to find out what type of crystals are in the wee, it's a case of taking your cat to the vet, obtaining a sample and sending it for analysis, so then the diet can be tailored to try and dissolve the crystals that are in the bladder. That will hopefully then lead to less use of antibiotic and medicine going forward, and a more long-term plan rather than just relying on injections and medication and trips to the vet, which are obviously sometimes stressful for your cat. Male cats with cystitis have to be treated with a lot of care, because sometimes if you have a cat that has crystals, the crystals will form a little stone. If that stone causes a blockage, then the cat will become very unwell. And with male cats, that especially is a bit of a concern. So if you have a very unwell cat that's constantly going to the tray to try to go for a wee and is unable to produce any urine, it's an emergency usually, because the worry would be that that male cat is what we would refer to as blocked, and the stone is blocking him from weeing. If that happens, he needs to be hospitalized as quick as possible and treated promptly. Once you diagnose the stone in the bladder, there's a couple of ways that they can try and help your cat. They'll have to remove the stone. Hopefully that will involve pushing the stone back into the bladder and then removing that stone and any other stones that are in the bladder under anesthetic with a little surgery to remove all the stones. But again, longer term, the solution and the main help will be diet. If your cat is showing signs of cystitis and they are showing a little bit of blood or straining, but they are producing wee, if you can obtain a sample, that can be cultured, and the vets can grow the bacteria that's affecting your cat's bladder. That will help them then pick an antibiotic that will get rid of the infection. If a sample is sent away to the lab, usually the crystals can be analysed, and then once they discover which type of crystal the cat has, they'll be able to tailor a diet specifically to dissolving the crystals over longer term. Stress is the other thing to watch out for with cystitis. If there's a lot of stress in the home, or there's a new cat or maybe new additions to the family, that can sometimes lead to cystitis as well. So it's important that if you do see those signs, that you are mindful that if your cat does get cystitis, it could be secondary to a stressor. Feeding a good quality food will also reduce the chance of the cats developing crystals in their bladder and also improve their general renal function. That's everything from me, Tony the vet, for now.